Friday will be even busier than usual for Dr. Joan Thomas.
The cardiologist of Rochester Regional Health will be seeing patients, but as Doug Emblich tells us, she will also be saying goodbye.
Yeah, goodbye after a career that makes Dr. Thomas someone you should know.
Here we go. One of the things that I'm most proud of is being a woman chief of cardiology, because we are few and far between.
There are only a few women serving as chiefs of cardiology in the whole country. There weren't many women at all in the specialty when Joan Thomas was just starting out.
I wasn't the only woman around, but we certainly were outnumbered. And back in the 60s, you know, I hate to say it, but our guidance counselors told us that girls could be teachers, secretaries, nurses, or moms. So those were our choices. Nobody said, Joan, you could go to medical school.
Dr. Thomas was a nurse first, then nurse practitioner before going to medical school and choosing to focus on patients with heart problems.
It's constantly changing. I mean, it's exciting. When I walk into this office or the hospital, you never know what your day is going to be like, which is fascinating.
A runner who competed in 3 Boston marathons, Thomas says she cannot go from 100 miles per hour to 0, so she's stepping away, gradually.
To be relevant, you have to work a little. You know, how do you mentor and say, you should do this? This is how I've done it. You know, I've been doing it. If all of a sudden you're retired. So the hours are long, getting called in the middle of the night. It'll be nice not getting called in the middle of the night.
And it will be nice to spend more time with her already retired husband, Bud. But she will miss her 1,000 patients, and they will miss her.
Every day, they're hugging me, they're crying, they're begging me not to leave. It's just that feedback that I've been getting for the last few months that's it's very gratifying. That I guess I did a pretty good job.
I mentioned she's stepping away gradually. She actually resigned as Unity's chief of cardiology back in August, but she wants to stay on, so she's going to stay a week a month, just work a week a month in large measure, so she can mentor the next generation of cardiologists and perhaps the next female chief of cardiology somewhere.
That would be something. Thank you, Doug.
Quite a lady.
Yeah, absolutely.